Amanda Salisbury, and my topic for 4-H is hoof abscesses. What are hoof abscesses? An abscess is usually in the hoof of a horse. An abscess is a localized infection in sensitive structures of the hoof. They occur in the hoof wall. As the horse's body responds to the infection, a buildup of waste matter and white blood cells usually form. This is also known as pus. As you can see, the abscess is in this section of the horse's hoof. As more pus builds up in the hoof, it causes more pressure in that area. This can be very painful for the horse, and this is why the horse can go lame overnight. Abscesses also can cause severe swelling in the hoof as well. The swelling can also occur in the knee or upper leg as shown in the pictures. So you can see the swellings in the knee, and then right here it's in the lower part of the hoof just above the coronary band. How do abscesses happen? A hoof abscess begins with bacteria entering the interior hoof structures. Anything that will weaken the interior hoof structure makes it easy for the bacteria to get into the hoof and cause an abscess. The weakening of the hoof can happen when the horse steps on a rock or if it steps on a nail. The puncturing or the bruising of the hoof can cause the hoof to crack, which then makes the bacteria able to enter the hoof. Environmental conditions can also cause abscesses. For example, if the ground is super dry, it can cause the hoof to crack. Then when the weather turns wet, mud can get into those cracks, and then the bacteria will begin to grow. As you can see, bacteria started to grow in this crack of the horse's hoof. How can you know if your horse has an abscess? If your horse has an abscess, it may go lame overnight, and it may not have any sign of injury on its leg. It may have swelling or sensitivity of the coronary band. A pulse might be found in the arteries that run down each side of the back of the affected foot as shown in this picture right here. How can you treat a horse with an abscess? To treat a horse with an abscess, you have to let the abscess drain to relieve the pressure. Some abscesses will pop on their own, but some need help to pop. The most ideal place for the abscess to pop is on the coronary band, at the very top. As shown in this picture right here, you want the abscess to pop at the coronary band. Some vets will pop the abscess through the sole of the hoof. After this is done, cleanliness is very important so that the hoof does not get infected. To keep the area clean or to draw out an abscess, you can soak that infected hoof in warm water with iodine and Epsom salt, as shown right here in this bucket. Wrapping the hoof is another way of treating abscesses, or it can be another way of protecting the affected area if the vet does pop the abscess. As you can see, this is a duct tape wrap you can make at home, and they just put like padding at the bottom to not irritate the hoof, but also just to protect it from dirt and debris getting into the affected area. How can you prevent future abscesses? Wet stalls tend to carry a lot of bacteria, so make sure you always keep your stalls clean. And you can frequently clean your horse's hooves to make sure that there's no rock or mud in them. And by doing this, you are ensuring that nothing can bruise the hoof or that no bacteria can get into cracks if there are any on your horse's hooves. Regular farrier visits can also help to prevent future hoof abscesses. If your horse's feet are prone to bruising or they are very sensitive, you may want to consider getting them shoed just to protect their hooves a little bit more. Are certain horses prone to abscesses? The horses that are more prone to hoof abscesses are horses with poor hoof quality, very long hooves, and horses that don't see the farrier very often. Horses with chronic laminitis and horses that are in poor environmental conditions are also more prone to hoof abscesses. As you can see in this picture, this horse has overgrown toenails, which makes it more prone to hoof abscesses. Okay, that is all. Thank you.